Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Upper GI bleed. So this occurs when the upper GI is injured or inflamed. So it can be injured or it can be inflamed. So it can be due to acute reasons or it can be due to the chronic reasons. So the upper GI bleed, it can occur in the esophagus. So it occurs in the esophagus, it can occur in the stomach or it can occur in the duodenum. Now duodenum, the second part of the duodenum, right above the ligament of the traits. So what are the symptoms of this? The symptoms of this, it includes the melena, it includes the black tarry stools also, and it can also include the vomiting, and there is a stomach cramps which can be also noticed. So there is also weakness, there's fatigue of consciousness, there's unusual pale skin also seen. Now what are the causes of this? Causes is, in case of the peptic ulcer, there is symptoms, that is a pain in abdomen, in the upper abdomen, and nausea and vomiting. Then esophagitis, that is symptoms of chest pain, nausea, vomiting, and the lack of appetite and the chronic cough. Now gastroenteritis, that is symptoms of nausea, diarrhea, the vomiting as well as the rectal bleed. Then the Mallory-Weiss stare. So Mallory-Weiss stares, the symptoms being the excess bleeding. So there is excess bleeding in case of the Mallory-Weiss stare. There is also the esophagus, esophageal. There is esophageal varices. That is symptoms of stomach pain, vomiting blood as well as a bloody stool. Then comes the gastritis. Gastritis, the symptoms upper abdominal pain, and the early satiety, the loss of appetite as well as the unintentional weight loss. Now cancer wise, if you see the symptoms, it is a swallowing difficulty. So the swallowing difficulty, the vomiting of the blood as well as the persistent cough and the unexplained weight loss. So how do you diagnose this condition? So diagnosis is by the stool test. So you do a stool test, you do a blood test, and there is a biopsy which is done. The imaging is also done. The gastric lavage can also be performed and the upper GI endoscopy can also be done. So risk factors includes the NSAIDs as well as the calcium channel blockers. Then there is also the BZP, there is the benzodiazepines and the tricyclic antidepressants, that is the TCA. Now treatment wise, you can do the IV fluids can be given, that should be administered to maintain the adequate blood pressure, for maintaining the blood pressure and the hemodynamic stability. Now we have the PPIs, they are used to treat the patients with non-variceal UGIB, non-variceal UGIB, and there is also the octreotide. There is octreotide or the somatostatin. Octreotide somatostatin analog, and it is used with the variceal bleeding is suspected. When the variceal bleed is suspected. Now, if the patient is not able to protect their airways or undergoing a severe hematemesis, the elective endocardial intubation is advised. So, elective endotracheal intubation is what is advised. Then the blood transfusion, it should be given target hematocrit above the 20%, and this is the hematocrit value greater than 30%. Next is such elderly and patients with the coronary artery disease. Next is the endoscopic innervation. So endoscopic innervation is needed depending on the findings, and this is during the upper endoscopy. So if the bleeding vessel is visualized or there is a stigmata, so there is a stigmata of the recent bleeding. So in such case, the therapeutic options, it might include the thermal coagulation, so there's thermal coagulation, and the local injections of epinephrine or use of clips. To learn and grow daily like this, please do subscribe.